Good afternoon, everybody. Welcome to our COVID-19 update. Happy May. It is Monday, May 5th today. Thank you for joining us. And I'm sorry, it's May 4th today, so even better. So May 4th today, it is Monday. Thanks for joining us. We will continue these updates on Monday, Wednesday, and Friday. Today, again, we have people, our leadership from Dunn County and Chippewa County joining us, the health officers from both of those communities, to really share with you that this is a team effort across the state. This is not just happening in Eau Claire, but is happening across the state. Our ability to contain disease and to respond to this disease, as well as put things in place so that we can reopen in this community, as well as all the communities across the Chippewa Valley, is a true partnership. So we're happy to have them here, and they will be giving updates as well. Today I'll give an overview again as an update on Wisconsin, and then Angie and KT will share Chippewa and Dunn County data, and then I'll come back and share a little bit more about what's happening in Eau Claire. We'll close with questions like we usually do. In Wisconsin, we now have 80,467 negative tests for COVID-19, 8,236 confirmed cases by testing of COVID-19, an increase of 272 positives, and 1,621 hospitalizations. About 20% of those that have a COVID positive test have been hospitalized at some point in the state. Deaths are at 340. The state now has 51 labs with a capacity of 11,347 tests per day being done. About 3,000 tests per day are being done at the state, across the state at all those labs. So we're still well below the capacity number and well below what we would like to be at for a state. That continues to be an important part of the work that everybody is doing. The state continues to focus on the capabilities in the Badger Bounce Back Plan. Those are the same capabilities that we know nationwide are in the White House plan. They include having PPE for people that need it, testing for everybody with mild symptoms, getting test supplies where they're needed, and doing contact tracing so we keep the case numbers as low as possible. The specific governor's media release today, really spoke to the testing component of this, a critical part of all of the work that's happening at a local and state level. The governor's speaking today at his press conference was really around testing in outbreak situations. So where we know that there's an outbreak, having intensive testing come in to make sure that everybody is looked at in that situation. We've seen that, for example, in the Green Bay area and in other places where there are outbreaks. Continuing that work with a team from the state. Newly focusing very intensively on long-term care employees and residents, and making sure that a high number of tests happen in those facilities is an additional focus from the governor's office. Drive-through testing, like our National Guard sites that we are having in this area, having community-level testing happening in a higher level is also a focus. And then supporting healthcare systems and having the testing supplies that they need for ongoing testing in every community. We have really good healthcare in this part of the state, in the Chippewa Valley. We are fortunate that we have many providers doing testing. We continue to work with them to increase their testing volume so that they are able to do tests and they're utilizing the state supply when they need that. And we're confident that those testing numbers will continue to go up. We now will hear from Angie Weideman in Chippewa County and then KT Gallagher from Dunn County with their updates about what's happening in their community. And I'll be back to share Eau Claire data shortly.
Thank you, Lisa. Good afternoon. My name is Angie Weideman, and I'm the Public Health Director for Chippewa County Department of Public Health. I'd like to give a few updates about cases in Chippewa County. Currently, we have 25 confirmed positive cases of COVID-19. 19 of our cases are released from public health isolation, and 6 are currently under public health monitoring. we have had 1,119 negative cases in our county. We'd like to talk a little bit today about contact tracing. Recently, all of our counties have seen an increased number of cases, and these positive cases have close contacts in the Chippewa Valley. This means that our positive cases have been out either for essential work and errands or non-essential reasons like gatherings with friends, neighbors, and have had close contacts with others. We are not advising people to go out for gatherings, but just wanted to give a visual representation today of what contact tracing looks like. We consider things like, where does somebody live and who lives in the home with them? Where do they work and who have they been exposed to or who might they be exposing at work? Have they gone to a bonfire or a gathering, which public health departments are not advising people to do? Have they been to a celebration? And again, we are not advising people to go to things like this. But if they do, they really are exposing a large number of people. You can see from the graphic, the number of people get bigger and bigger and bigger the more places that people go. That's why it's vitally important for everyone to follow recommendations and to keep your circles small. Contact tracing does take quite a bit of time for public health departments to follow up on. And the more people have been exposed to, the more difficult it is for health departments to follow up with everybody and ensure everybody's safety. So just wanted to kind of remind people to follow that safer at home order and to take it very seriously to keep their circles small. Basically, we would just want to say to please stay at home unless you absolutely have to go out. I know that it's getting harder as the weather is getting nicer, but staying at home does save lives. Also wanted to update people on some testing sites that are going to be coming available in the Chippewa Valley. I'm going to talk about a few, and then KT is going to cover a few as well. Chippewa County is partnering with our local health departments and the National Guard to hold day-long testing sites. If you are symptomatic, you can visit these sites for free COVID-19 testing. These will be held Wednesday, May 13th from 11 a.m. to 7 p.m. at the Thorup High School, and Thursday, May 14th from 11 a.m. to 7 p.m. at the Rusk County Fairgrounds in Ladysmith. Chippewa County residents can visit the Thorup or Ladysmith testing sites. They also can visit the Eau Claire Dunn site, as that may be closer for some residents of Chippewa County. Again, KT will talk more about that shortly. For information about all the testing locations, you can visit any of our Facebook pages or websites. We all have information about these testing locations. I do know that it is difficult for people to be at home and to isolate themselves from those that they love. I would ask that people think about how unified we are across the world right now. We're all dealing with the same situation. We are all dealing with challenges, and many are taking time for new opportunities as well. I've talked to a number of people who have cleaned out their closets, created scrapbooks, started learning a new hobby such as playing the piano, are preparing for their garden, are taking to the bike trails. Please consider the things that you have control over and the activities that you can do safely. Now I would like to introduce KT Gallagher from Dunn County Department of Public Health.
Thanks, Angie. My name is KT Gallagher. I am the Dunn County Health Department Director. First, starting with a situational update for Dunn County. We have had over 1,000 people, so 1,074 people in Dunn County test negative for COVID-19. We have had 12 Dunn County residents test positive. And then we've had 9 people be released from isolation. Of those 12 that have tested positive in Dunn County. And then, like Angie had shared, I want to walk through the different mass swab collection or mass testing sites that we have, starting on the 1st of May and going all the way through to the 14th. We have 10 different sites in the northwest region of Wisconsin that we're really excited to increase that snapshot of how many people in our region are sick with COVID-19. So starting on May 1st, we had on Friday a mass collection site in Buffalo and Pepin counties, so serving the groups out there in Alma. They were able to swab about 200 people, which is fantastic. And then yesterday and today, we have folks in Barron Polk and St. Croix tribe being tested up at the St. Croix Casino in Turtle Lake. And then on the 5th of May, we will have up at the Burnett County Highway Shop from 9 to 6, mass testing site servicing folks from Burnett, Polk, and St. Croix tribe as well. And then going up just a little bit while north on the 6th in Solon Springs Community Center. There will be a site there on the 6th in Solon Springs servicing the folks in Douglas and Washburn County. And then on the 7th, just a little ways over at Lake Superior Elementary School in Binsfeld, there will be a site set up from 11 to 7. And then coming back a little more locally on the 8th and 9th, helping to provide coverage for Pierce and St. Croix County, but then also I'm sure folks from Dunn County, especially the western part of Dunn County, may find this site more accessible for them. Over in Baldwin from 11 to 7 on the 8th, and then on the 9th over at the St. Croix Valley Business Innovation Center in River Falls from 9 to 4. And then the site that we talked about in Dunn and Eau Claire County at the Prevea campus at the CVTC site on Claremont, being open on May 10th from 8 to 5. That is a Sunday. That's going to be how I spend my Mother's Day. And then on May 11th, again on Monday, from 11 to 7 p.m. So getting a good spread of coverage there. And then the two sites that Angie had shared in Thorpe on the 13th and on at the Rusk County Fairgrounds on the 14th. So like Angie had shared, we want to make sure that this is accessible. You as a symptomatic, so if you have symptoms and you are a Wisconsin resident, please go to the site that makes the most sense for you, that limits the amount you have to travel. Please be patient. Bring things with you to keep in your car to keep you occupied. There may be lines, especially in the beginning. And again, it's really for us to understand folks that are symptomatic with the symptoms that we've all talked about, shortness of breath, a fever of 100.4 or higher, a dry cough, but also some of those milder symptoms like chills or a little bit of nausea or diarrhea or loss of smell, that we get you in to be tested. Some of our health systems have had really good coverage and have been able to test even the most mild of symptoms. But that hasn't been the case throughout our region. And so we want to make sure that folks with mild symptoms that haven't had an opportunity to be tested do now. Again, go to the one that's closest to you, get tested. I think getting tested is so incredibly important for the symptomatic folks within our region for two reasons. I think there is at least in Dunn County, a perception that we haven't had a significant increase in cases for a long time. We stayed at 9 positive folks in Dunn County for almost 3 weeks. There was a perception that the virus just went away, that it isn't there in Dunn County anymore. And that's absolutely not the case. We know it hasn't gone away. We do know that safer at home works, and we aren't seeing the flare-ups or the sparks. We know that it doesn't matter your age group as far as whether or not you get the disease or get the virus. We have about 35% of COVID-19 cases in the state have been under the age of 40. 36% of the cases have been between 40 and 60. And 29% have been 60 or better. That's a pretty equal distribution. So just because you're under 40 doesn't mean you're less likely to get it. What it does mean is that you're less likely to be hospitalized or to die. And so we know that in the state, nearly 60% of people that have been hospitalized have been 60 or older. And so if you're somebody that's under 60 or under 40, and you have somebody in your small circle who is 60 or better, it's really important that we keep them safe by not contracting the germ ourselves, by staying home. Thank you for the hard work you're doing, the public health work you're doing to stay home and to stay safe, and doing the things that we know are important to keep our circles small and to limit the amount of contact tracing all of our departments are doing as people are really interested in reopening the economy and getting out into the sunshine. Thank you.
Thank you both, Angie and KT, for those updates. As you hear from all of us, we are working closely together to make sure that we are containing disease the best we can, with a disease that none of us are immune to and really any of us can get. In Eau Claire, we today have 43 confirmed cases by testing of COVID-19, an increase of 9 cases since Friday. Clearly a significant uptick in Eau Claire County. Those cases, as we've done with all our cases, are carefully investigated and contact tracing is done. So extensive interview with the case, making sure that that individual isolates until they are symptom-free and meet the criteria for being no longer infectious. And then all of those people that have been in close contact with that individual case, all 43 of our individual cases, making sure that we are doing the contact investigation that's necessary so that those people stay home and we don't have further spread of disease. If we want to reopen, we need to be really, really good at this work. We need people to be very honest with us about who they've been in close contact with so that we can carefully and significantly stop the spread of disease. As was talked about with the graphic, we have contact tracing that can happen with a very small circle, or we can have contact tracing that has to happen with a very large circle. So, for example, an individual that's positive, that's attended a bonfire with 20 of their closest friends, has 20 more people that have to stay home for 14 days. We know those events are good and fun and things that we love to do, celebrations, having parties and having gatherings, being together, especially with good weather. But our ask is to continue to keep people's circles small as possible. When you're out, to keep physical distance, and when you're out, to use a cloth face covering to protect others from getting the disease from you and to protect you from getting the disease for others if we all regularly wear those face coverings when we are in situations where we're in contact. Our testing numbers in Eau Claire, we've tested 2,289 Eau Claire County residents. 2,192 of those tests are negative, with 54 yet pending. Again, our numbers for hospitalization, like are reported for all of the counties, really are given on a state level, partly because our numbers just are not reliable enough at any one point in time, but also because those numbers are protecting people with their privacy. Like all the counties, we have people that are positive that span the age groups and gender groups, and those are important for all of us to remember that, again, nobody is immune from this disease. We have unfortunately been seeing a slow decreasing of testing that's happening day by day in Eau Claire, with a couple of small peaks, about 40 to 50 tests per day being done of Eau Claire County residents. Our goal is to increase that. And again, as I said in the beginning, that is also the governor's goal and the push from the state health department. We are partnering with our community not only to do the community event for a one-time blitz of testing, but also with all of our healthcare partners to increase those numbers. Again, our daily increase of tests and our daily increase of positives are important numbers for us to continue tracking. Like most places, our infections per 100,000 population is around 40. Some places across the state, those infectious rates are higher, but we are pretty similar to most places around the state. Often we also track the doubling of cases. That was one of the measures that was utilized in the beginning of the discussions to go into the Safer at Home order, is to really look at how do cases double and how long does it take for our cases to double. As you see with 43 cases today, we are decreasing the amount of days for doubling very quickly now. And that's one of those measures that's not necessarily going in the right direction, but we will continue to watch it. We know we have disease in the community. As a follow-up to the sharing of our Chippewa and Dunn partners about testing, we really know that for every test we do, it's more likely that we will get a positive back. Our goal with the community testing that's happening next Sunday and Monday is to really get a very good sense in our community of those people that have low-lying symptoms that may have otherwise not gotten tested, to really get a good sense of how many of them may actually have disease, so we can continue to contain the disease. Our goal is about 300 tests a day. We again are inviting everybody that it does have symptoms to come to the testing sites that were listed by KT. The ones in Eau Claire will be Sunday and Monday, and those hours are readily available on all of our websites. There is no requirement that you have a healthcare provider on record. There is no requirement that you have health insurance. We are really encouraging everybody to participate. There is no cost for any of the testing sites that are being held with this National Guard asset. Our time to contain the disease is really on us now as we have additional cases. Our ask of people is to, again, keep their circles small, to maintain physical distance whenever they are out. Those are the ways that we will stop spread. And to get tested if you have symptoms. So the strong push is, please really work with your provider, if it's not during the days that we have upcoming, to get a test done at any point when symptoms occur. A couple of additional updates. We are awaiting the Supreme Court discussion tomorrow, which will happen related to the Safer at Home order that the Secretary designee Andrea Palm put forward. That is the order that we are operating under now. We continue to work with state and local partners about the Badger Bounce Back Plan metrics and capacity. We all know as public health officials that we need to make sure that we are building capacity so that we can respond as we safely and strategically reopen our communities. We also are making sure and daily responding to questions of our essential businesses and those essential activities that are happening to make sure people know how to do them safely and are getting the guidance to do them safely. We also respond to complaints when we hear them from the public, and that is ongoing work that our team does to assure that education is available to everybody, so we're doing the right thing. The goal is that we have safe community for us to interact in, given this really unprecedented time with the disease. An enormous thank you to everybody in the public that is paying attention, that's not being panicked about this, but paying attention to the common sense things that they can do. So our enormous thanks for those that are keeping their circles small, that are limiting their activities to those things that they really have to do. When they go out in public, that they're making sure that they keep physical distance and that they are wearing cloth face coverings when they know that they are going to be in closer contact with others. That way they keep each other safe. You all are keeping each other safe, and you're keeping those essential workers that are working at the businesses safe as well. Also remember to take care of yourself. This is difficult. It is hard for all of us, as all of the previous people have said. KT and Angie and I all understand that. And we want for people to find ways to take care of each other and take care of your loved ones. Our website is the site of information for all of you to get updates. That's coronavirus.echealthdepartment.org. Again, that's a newly formatted site that has a lot of information on it. It should be readily available to people on all sorts of devices. Our COVID call center continues to take calls and answer questions. If you can't get information on the website, that number is 715-831-7425. We'll continue with media briefings Monday, Wednesday, and Friday this week, and the three of us can now answer questions that you may have. Yes?
You had touched on this a little bit last week regarding the overall percentage of positive cases versus the number of tests that are being done. Mm-hmm. Are we still seeing about the same number percentage-wise of, versus the number of tests done and the number of positive cases? Has that percentage gone up over the weekend? Can you touch on that a little bit?
Sure. So the question is really about the percent positivity, one of those numbers that we're tracking carefully. So of the tests done, what percent are positive? We are seeing increased positivity in this part of the state and certainly in Eau Claire. So the state is at around 10% of the tests that are done are positive, and that's for a variety of reasons. Certainly a lot of tests are done in outbreak situations, and in those outbreak situations there will likely be more positives. We were seeing much lower positivity rates across this region, but certainly in Eau Claire, right, less than 2% positivity. And those positivity rates are increasing in Eau Claire. Ours 7-day average is at 3.6% now, so it is higher than the just below 2% that it was previously. We know that as we test more, we will find more, but on average, our hope is that the positivity rate stays fairly low. So we will be watching that. It's one of the signals to us that there's increasing disease in the community. As testing goes up, if positivity rate also goes up, that means we likely have more disease in the community that's spreading. Yes?
Other than these National Guard testing days, can you speak to what testing options are available to folks who don't have health insurance?
So the question is, what testing is available to people that don't have health insurance outside of the National Guard dates? There are testing sites in Eau Claire that if you call them and talk through what options you may have related to health insurance, many of the sites are not turning people away. So certainly there are all of the healthcare providers that are doing testing. It's a phone call to their nurse triage line to talk that through. It is a barrier for some, and that's why we are having the National Guard testing happening now. And certainly if people are running into challenges, we encourage them to call our COVID hotline, and we will talk through with them what those options may be. Yes?
We heard that the health department teamed up with the university and to put out the information in Spanish. Why do you think that's important? And with the large Hmong population here, do you plan on putting that information out?
Sure. So the questions are really related to having COVID-19 material available in multiple languages. We have partnered with a number of community partners, UW-Eau Claire being one of them, but also a number of community members that are in the Hmong and Hispanic communities. And we are working on having web links available on our website. There are videos there now for Spanish-speaking individuals, and we are working on those for Hmong-speaking individuals. They will be available available on the web this week. There are print resources that the state has put together, and we are also supporting and are readily available in multiple languages. We also have access to translation resources for all of the kinds of work that we do related to case investigation and contact tracing. Critically important because we have populations across our state that have language barriers, and all of my peers across the state are working to make sure that we do whatever we can to make sure that information is available. Yes?
With testing numbers being down in Eau Claire County, you said, is it possible that's due to kind of it being May, warmer temperatures, cold and flu seasons kind of passed us by? Is that possible?
So the question is related to testing numbers being down. Is it possible that it may be season related, or cold and flu symptoms may be decreasing because of the time of year it is? The national work that's being done on COVID-19 is not necessarily seeing a seasonal change with COVID-19 cases. That is something that's still being investigated. Obviously, a brand new disease. It is possible that some people are having less symptoms related to influenza, and that influenza number is significantly down across our state at this point in this time of year. So people that do have influenza are less. Our testing numbers are only down slightly. Our goal is to continue to increase the numbers. So more importantly to remember is that we want testing numbers to go up, not stay flat. If we're really going to get to the place that we need to be in order to continue to open our economy, we need to have the number of people tested be all those that have symptoms, and we're not there yet. Yes?
You had mentioned the number of people that were essentially free from quarantine, symptom-free. Is the health department still in contact with these individuals? Has there been any issues of like relapse or anything from anyone that's recovered? Have you guys seen any instance of that?
So the question is related to our positive cases. Have we noted any of those that have now been symptom-free, have been released from isolation, that are no longer considered infectious? Have we had any follow-up with any of them because of problems? I'm not aware of any concerns that have come from the cases that we have had locally. Certainly, as people are released from isolation, they're given very clear directions to stay in contact with the health department if there are any concerns or questions they have, and that's certainly the path of information that we would get back to us if there were any problems. Yes?
In the call with the governor today, Dr. Ryan Westergaard, the chief medical officer, said that the goal is not herd immunity, that the goal is to limit transmissions. And so I'm just curious, I mean, we can, at the same time, like Dr. Michael Osterholm, who's a leading epidemiologist nationally from the University of Minnesota, said last week, quote, "This virus will not stop trying to infect people until we get it to at least 60 or 70% level." So, I don't know, I'm just trying to, how long will it go on if the goal is to limit transmissions? It just seems like this is just going to go on and on and on.
Sure. So the question is related to really the length of time that this disease will take to either get herd immunity or get to the point where we have a vaccination that can prevent the disease. How long is that going to take? What is our goal, and how quickly are we getting there? Is that a fair summary of the question? So we continue to focus on the slow and strategic reopening of our community, because in the end, we don't have capacity for sudden herd immunity to happen. So state medical director speaking about our goal immediately definitely is not herd immunity, because that would be too many people at the same time. 70% of our population in Eau Claire would be 70,000 people would have to have the disease in order for us to have herd immunity. If you can imagine 70,000 people with the disease and how many at the same time might need health care, we don't have sufficient health care to safely and effectively support those individuals to survive. I'd much rather, and I think all of us would much rather, have our family members get very sick and be hospitalized with this disease when there was sufficient capacity to support them. So while longer term herd immunity is the goal, getting there strategically and slowly is part of our job in public health. We need the PPE, the personal protective equipment, so that we can protect the workers that are supporting people that are getting ill. We need to be able to test. So we need to get to that number of tests done per day, per week, so we know who is ill and we can make sure they stay home. And we can need to do the contact tracing. All of those are pillars of the plan moving forward. Again, in the end, the goal is not that nobody gets sick. We will have people get sick with this disease over time, but to keep our circles small so that illness happens more slowly, and frankly, so that we have increased ability to have good treatment for people. Every day, I'm sure people are noticing that there are better treatments available for people that are hospitalized and extremely ill. Every day that goes by, we will have better ways to treat those people that are in that situation. So spreading it out makes very good common sense. We also have to strategically and safely open our economy, and doing that in a measured and in a risk-based way is part of the work that we're doing now.
It was announced today at the governor's news conference that we're now able to sanitize and reuse PPE. But what are we doing? Do you know of anything, you or any of your cohorts know anything we're doing to manufacture more PPE and to increase our stockpile?
Mm-hmm. So the question is related to PPE. There is a lot of effort going in at the state and federal level to work on PPE as well as locally. So we do have new sites available for decontamination of certain PPE, particularly the N95 masks that are used in very close contact situation by healthcare workers and by first responders. Those N95 masks, there are methods to decontaminate them and reuse them. That is certainly something that is being promoted. The machines are now available across the state to do that. And in Eau Claire, we're pulling together our agreement right now to have a site available for all of our first responders to collectively use. So that is going on in our community and across the state. We are also working with the state to get more PPE available. So every week, shipments of PPE that come into the state are being distributed across the state, prioritized based on those places that most need that personal protective equipment. Typically, gowns, masks, and gloves are the things that are in highest need, as well as face shields. So the state has been very successful in getting PPE made in higher quantities and brought in. There are still some shortages. At this point in time, the healthcare community is letting us know that they are doing fairly well with their PPE. But I think everybody else has to remember that we are, because of this disease, using personal protective equipment in ways that we never used to. So our supply chain wasn't making PPE for this kind of situation 6 months ago. So ratcheting up of that takes a little bit of time, and we are certainly seeing that happening. Cloth masks or cloth face coverings are something that many of our local providers are now working to make available. So we have a number of local places in Eau Claire and across the Chippewa Valley that are really working hard to make sure that all of us, people that are in the community that can use a cloth face covering, have access to that as well, which has been an enormously positive example of community leaning in to keep each other protected. Yes.
My question is about contact tracing happening in Eau Claire County. Is the health department having to contact more people per case as time goes on? And is there a rough average of how many people that you guys have to contact?
Yeah, it's a wonderful question. So contact tracing, are we increasing the numbers of contacts that we need to trace as this disease has progressed forward in Eau Claire County, and what are those numbers? That's actually one of the data points that we're starting to work on right now. It's not entirely simple to pull from our system, but that is one of those things that we will readily have available, hopefully in the very near future. It's important for us to understand where that's going. So if we were starting 3 weeks ago under the kind of core of Safer at Home with a very small number of people, just the household, and now we are progressing to to having 10, 12, 20 people, we get an idea not only of what's happening with people keeping their circles small, but we also understand better what our capacity needs are. We have had a number of our cases, the new ones that have come in the last week or so, going from 21 cases a week and a half ago or so to the 43 we have now. In that group, we have a number of them that have a lot of contacts, and that makes for very complicated work. And we need to hear from cases who all their contacts are. That's the only way we'll contain the disease. So we want to know if people are doing things that are outside of just their household contacts, but it does make things more complicated. A number of those people that were contacts to an original case in our community and across the state are also now cases because they did have symptoms, and when the investigation happened, they were tested, and they are now a case as well. Yeah.
I appreciated your answer to my earlier question, and if you allow me just to briefly revisit it, the idea of herd immunity, and speak to the person when you say making sure our healthcare facilities can handle the load, like seemingly they can. Medical facilities have all cut pay by about 10% and furloughed people. So it's still, can you speak to like time in terms of how long this goes on, how slow? I appreciate it because unlike the earlier answer on the governor's call, you did acknowledge eventually we do want to get to herd immunity, but I think for people they're wondering like how long?
Sure. So again, going back to the question of herd immunity, especially the metric around healthcare capacity and keeping the number of sick people that are sick at the same time as low as possible, we do know in this Chippewa Valley area that our healthcare system has not been taxed by COVID-19 cases. We want to keep that low. All of our healthcare system partners last week communicated that they are starting to reopen some of their non-COVID related activities, so elective surgeries, those things that they had not been doing for a few weeks, they're now starting to do. So their capacity to expand just with COVID cases will decrease with them doing additional healthcare work, and that's appropriate. We want them to have the ability to do the work that they are supposed to be doing. We know, though, from other communities that an enormous spike in cases does tax the healthcare system. So managing that fluctuation is part of what we need to do over the next number of months. We know that the vaccine will not be available for many months, and so as we reopen, which is slowly and progressively happening now with the interim order from last week from the governor, we know we will see more cases, and it's really it's a careful balance of what we open will impact cases, and really doing that from a risk standpoint and paying attention to physical distance and those places where we can really engineer ways for us not to get sick. So it's going to be a lot of back and forth over the next number of months, I would imagine. All of the guidance at a federal level, the White House plan, for example, includes much later reopening of very large mass gatherings because of the issue around exposure. So risk-based reopening is what we're expecting moving forward. It's what the Badger Bounce Back Plan includes, and that will help slow and make sure that we don't have those overruns of the system. We hope and encourage healthcare to be back to business as much as possible. They have new guidelines in place, people having to wear a mask when you come in, having fewer visitors. Those things likely will stay in place, but the ability for healthcare and our healthcare system to operate is critically important.
I was curious to hear, Mother's Day is on Sunday, and you talked a lot the week of Easter about that, but I think as much or more, traditionally I think it's the busiest day at restaurants. It might be different this year, but like for us to be as real as possible, like people are going to be really tempted to see mom and grandma, and so if you could speak to that, as well as, I don't know if your cohorts are still here, but then also even the screen policy, I'd be interested how you talked to us some here about visiting those in long-term care facilities through a window. I'm just curious how Eau Claire, Chippewa, and Dunn compare and contrast on that.
Okay. So we know Mother's Day is coming up, which is a wonderful holiday. I think all three of the health officers in the room are mothers, so we're hoping to have our children help celebrate with us on Mother's Day. Our encouragement, it continues to be the same, that those ways that we can connect with our loved ones that don't involve, unless we currently live with them, that don't involve coming into physical connection with them is really the safest thing to do. I have an 83-year-old mother that I love very much. She's fortunate to live on her own, but we'll be connecting via electronic means and not in person, even though she lives in Eau Claire. Our responsibility as family members really needs to first think about the fact that we want to protect those people, and that is our highest risk age group, those people that are over 40, myself included, and those certainly over 60, those mothers that are in situations where they need to be protected. We want them to be here next Mother's Day to be celebrating with us. And putting them at risk is not the best gift we can give them. Our encouragement continues to be connecting in other ways, sending really thoughtful notes, making sure that you're connecting electronically if you are able to do that. Those people that are in long-term care facilities, certainly allowable. Visiting through doing those kind of through the window visits is allowable with the governor's order. I continue to not recommend that happening. The risk is enormous, especially given nice weather, that those windows open, that the desperate need for physical contact with our loved ones is there, and that it's tough on people to not reach out and give a hug to our mother that is on the other side of that window. I still strongly recommend that people reconsider that and don't do that as part of their celebration of Mother's Day. If their parent is in a facility where they can find a way to do that in a very controlled environment, that certainly creates safety. But I think many of our facilities have lots of windows, and there's not an ability to really help support that in a safe and effective way. It is certainly allowable, and we understand that. It's just an ask and a recommendation that people find another way to connect.
You had mentioned around the election that the election is going to be one of the data points that you guys are going to track statewide. Number of people who have voted and if they were, tested positive.
Mm-hmm.
Do we have any numbers regarding the number of people who have tested and have voted? Is there any reason to, tie in the election with the increase, aside from the increased number of testing, but is there any tie in there?
Sure. So the question is related to the election and whether there is any tie-in between the election and increased number of cases. I am not aware that there is any specific connection for our Eau Claire County cases, the 43 that we have related to the election, although I would have to do a double check to be certain of that. The state is asking in our state data system for all of us to record that as part of the work that we do with all of our cases. There are outbreaks related to the election that correspond to people being at election sites. I believe that number is around a little over 50 people have some connection to an election site and are positive. Again, it's not causal. It doesn't mean that is definitely where they caught the disease, but it is a correlation that has been made for over 50 people that are currently positives in the state. Yeah.
Well, just one last question.
Yeah.
We had touched on this last week too. There still seems to be a lot of confusion surrounding with golf courses, what's allowed on the courses, what's not allowed on the courses. You mentioned that you wanted to touch base with your team, last week when I brought it up. Is there any, update to that? What can we tell people who might call us or email us or whichever regarding what is the guidelines for them.
Golf courses. So the question again is related to golf courses, something that we've talked about a number of times. The state did come out with new information related to golf courses, which was a question that many people had. Initially, golf courses with their clubhouses, because the golf course as an entirety is considered a premise. The original communication was that there was no food carry out on the premise as a whole, which would include the golf course as a whole. The state has clarified that. Today we sent out a new update to all of the golf courses locally that did include information that did reinterpret that guidance that we originally received, and carry out onto the golf course itself is allowable from the clubhouse, but not on the immediate surrounding premises of the clubhouse itself. It is different than what was originally shared, and it's one of those clarifications that we just got today from the state. Again, with every outdoor activity, our continued encouragement to people is to get outside. It's beautiful. We are lucky to have a beautiful spring in Wisconsin, my favorite time of the year. My encouragement is to enjoy outside, to keep physical distance from people when you do that, and to stay with your household when you're doing that so the spread of disease is minimized. But enjoy Wisconsin. We're lucky to have the state we have. So thank you, everybody. We will be back on Wednesday to answer more questions and give an update, and we appreciate people sharing the good information that is available with others in your networks. Thanks.